Well, cancer diagnosis is never easy to hear, though there is new promise. Immuno-oncology treatment option now available for certain patients with hard-to-treat cancers, including head and neck. Dr. Michael Gibson, medical director of the head and neck team at the University Hospital Seidman Cancer Center in Cleveland. Carly O'Brien is with Cancer Care. Good morning to both of you.
Hey, good morning.
Good morning.
Dr. Gibson, I want to start with you. Head and neck cancer. Can you explain what it is, and I guess how does it compare to other cancers in other parts of the body?
Yeah, I would say it is a bit under-recognized. There are 60-ish thousand cases that are new per year in the U.S., so it actually isn't that rare, to be honest, although it is a bit difficult perhaps to get a handle on because there are many structures in the head and neck area, like the tongue, the lips, the voice box, and other areas, all of which can get a cancer, and each of them would be referred to as a head and neck cancer.
Yeah, what are some of the symptoms? I guess it depends on where it's at, though, doesn't it?
Yeah, good point. So, for example, the voice box or the larynx, you might be hoarse if there's a cancer on the vocal cords. If you have a cancer on the tongue, you might see it. It could hurt. It could bleed. You know, if you have a cancer farther down in the back of the throat, you might have trouble swallowing. So a number of different findings depending on the site of the cancer.
Well, like anything, if something doesn't feel right, go get it checked out. But I'm really anxious to hear about the new treatment options. What's now available to patients?
Yeah, so I would say overall there's much to be encouraged about. There are many, many therapies under study in clinical trials, not only in this country but around the world. Something that has come out of such trials is a set of drugs that are referred to as immunotherapy. And the way they work is they activate the patient's own immune system against their tumor.
Carly, I want to bring you into the conversation a little bit here. What kind of support and I guess what kind of resources are also available for people with this disease?
There's actually a lot of support available to patients who are living with head and neck cancer. And I think because it's a lesser known diagnosis, people don't often realize that there are disease-specific resources out there. So organizations like the Head and Neck Cancer Alliance, an organization called Support for People with Oral and Head and Neck Cancer, or SPOHNC.org, really provide information and advocacy and resources, information for patients. And then there are organizations like Cancer Care at cancercare.org, which is a national nonprofit organization that provides free professional supportive services like individual counseling, support groups for patients and their caregivers and loved ones. So I think patients need to know that there's a lot of sort of practical and medical information out there, but there's also information on supportive resources like support groups that are out there.
Right, but I'm also wondering what questions should they ask their doctors?
We encourage patients to ask their doctors any and all questions that they have. So they want to ask their doctors what stage or what specific type of head and neck cancer they have, what type of treatment options are available to them, as well as what kind of side effects they can expect from those treatments. Their medical team can provide helpful information and guidance on other resources and information that would be helpful to them as well along the course of their illness.
Yeah, and then the other side of this. I'm sorry, doctor, go ahead.
Yeah, well, that's okay. I would just second the comment that any therapy, be it immunotherapy or other treatments, one must discuss in detail the risks and the benefits of the treatment with the doctor who would be overseeing the care. Very important.
Yeah, and then there's a whole other aspect of this we haven't touched on with family members and caregivers, what they can do, but can you direct us to a website where our viewers can learn more about resources and I guess the new treatment?
Yeah, I'll start. I have two sites to recommend. The first is the website for the National Cancer Institute, and that's simply cancer.gov. The second site is of the National Comprehensive Cancer Network, or nccn.org. And Carly has some as well.
Yeah, and on the supportive front, like I mentioned, cancercare.org is a really good resource for general information about coping with cancer, both geared at patients and their caregivers and loved ones, and that website is cancercare.org. and support for people with oral and head and neck cancer at spohnc.org, as well as the Head and Neck Cancer Alliance.
Just wonderful to see there's some advances in this area. Dr. Michael Gibson, Carly O'Brien, thanks for your time this morning.